One of the biggest areas that Valle needed to improve upon was accessibility. We had our patient portal and elements like that, but we did not have full accessibility to our patients the way that I feel in 2025 we should. There was a lot of manual processes. There was a lot of patients filling out forms manually on paper when they came into the offices. There was a lot of the clinical side that we were missing specific items, like we weren't getting their full medical history or they weren't providing their medication lists and things like that. So we vetted 3 or 4 different vendors, and from the very beginning we all knew that Luma was the one for us, almost like dating. The biggest piece for us was not only the amount of functionalities that Luma had, all the features and the different ways we could use it, but it was also the fact that all the data goes into NextGen Live. That was one of the biggest key pieces, is when it can integrate with your EHR system. That's a game changer. It's a huge game changer, because otherwise you're turning manual processes into automated processes that still have manual processes attached to it, right? Because if it doesn't integrate, you're still going to have staff that are uploading things and making sure that it all is still going into the EHR.
They integrate as soon as a patient comes in. If it's an in-person patient, the front desk will check them. We'll make sure everything was completed in Luma. Once they're checked in, everything that they've completed in Luma automatically transfers over to their NextGen chart.
Our biggest goals that are coming in the next 3 to 5 years, we have some really big goals as an organization. We have a strategy, and I think NextGen and Luma are going to be amazing tools and resources to get us there.